Delighted to have in the studio with us today. Diane Kosmatka is back with us. She's an RN and Community Liaison for Providence Home Services and the current chair-elect of COHO, which is Choosing Options and Honoring Options. And we're here to talk about, again, the series that's been going on. We had her on right at the beginning, Conversations About Dying and Living Well Until It Happens. And a very successful series and a tremendous resource for the community.
It has been.
Yeah, so your next one coming up, you're saying these next two are biggies.
Yeah.
The scenes from the end of life. Tell us about that.
Well, it's going to be some Shakespeare actors that will act out kind of the scene about someone's illness and end of life, having not had that conversation that's key about, you know, making your healthcare choices, and do you want to have advanced care, intubation, ICU, tube feeding, and then the person who had that conversation, how it would look differently.
Wow.
So this is a real creative approach. Shirley Patton, I believe, had a family member who died on hospice, and having gone through it, retrospectively, people learn a lot. So they thought, let's put this together in a visual. So it's a different format for people to see.
And that's kind of what this is all about, folks. What you have here is, and I can tell you, in ministry, I have been to the bedside of so many people that did not prepare for that. And it really is a hard thing to deal with. I mean, the family's not ready, and then all the decisions that have to be made, and that's what this is all about.
Yeah, seeing families in turmoil is it's pretty gruesome at times, most of the time.
So, what at the end of all these, what will people learn?
You know, through all of them. I mean, some people have gone through. They've gone to a couple, they'll pick and choose and say, that's interesting, and I don't want to go to that one, that's not interesting. But typically, what they're going to learn is the importance of advanced care planning for individuals to make sure that they fill out what their wishes are on an advance directive, naming a surrogate, naming someone who will speak for them if they can't, and then the post form. But primarily, the advanced directive entails having people's wishes documented in a legal format that kind of goes with you if families can find it. It's not back in the safety deposit box. And then having that available for the healthcare team so that they know what's their wish here.
All right, and again, I think one of these, this is best emphasized. Coming up next, you'll have families telling their stories.
Yes.
And then the last one is advanced care planning. It's a workshop where a lot of the practicum of this is going to be handled. And part of this, and it's a difficult subject, but dying with dignity.
Yes.
I mean, that's what it's really all about, isn't it?
Yes. The big misconception is if well, a couple misconceptions. If I don't say anything, they'll do everything. It's absolutely right. Healthcare team's going to do it all. Yeah. You might get things you don't want. You might get a tube. You might get intubation, hands tied down in the ICU, people fighting to take those things off of them.
And that's because they're under their directives to do that. If you haven't signed anything that stops them from doing that.
That's right. You start coming into the hospital, the minute you walk in those doors, boom, we're going.
Yeah.
And everything is based on best practice. So if this lab reading says this, we do that. If you show something on an x-ray, boom, we're going to get consultations and doctors, and it's this full court press, which sounds good to most people, but enter in a 97-year-old from an Alzheimer's unit, and there's no family left. There's maybe a POA in a distant part of the country, and you're trying to find them, like, what do you think this person wants? They now have a broken hip. They're probably not going to make it through surgery. What are you going to do?
What do you do?
Yeah.
All right, so when is the right time to start this planning?
I think as early as people have that conversation, it's not going to be a bad conversation. Like someone, well, remember the big news, Terry Schiavo, Karen on Quinlan, young people with a tube, an MVA, a real bad motor vehicle accident, a drowning, where people have had emergency response. They brought the person back, but they're comatose, vegetative state. So that's where I don't think it's too awful to have a young person say what they want.
And this is a big picture thing, folks. I have to tell you, I dealt with it when I was sitting down doing our will and trust and all of those things. All of these directors came involved in that. In fact, since the last time you were here, I went through and looked at my, okay, did I do it right? But that's what it's really all about, is planning that far down. All right, now, let's talk about these forms, because you got some things that are pretty practical. The big pink one, I think everybody needs to know what this one is.
A lot of people have never heard of that. It's called the POLST, and they say, what? It's like a foreign language, but POLST is the acronym, but it stands for Physician Order for Life-Sustaining Treatment. So a doctor actually signs that, and that's a physician's order that, or a nurse practitioner, because the nurse practitioner can also sign, someone who knows you and says, you know, this is really appropriate for you, Perry. I think this is, yeah, we're right on this for your condition. So if you had advanced, let's say, tough diabetes, brittle diabetes, you've had chest pain, you're going to go into some cardiac events because of, you know, debility, or maybe your kidneys are failing. So what do you want to have happen if things get really to the end?
Right.
So you and your doctor can talk that over.
Okay. And by the way, and these should be posted, or at least somewhere. I know in homes of the elderly, they're on the refrigerator, and they should be.
Right.
In case an ambulance comes in and they see that, and then they know what to do, right?
Right. They save time, and it's usually right on the refrigerator, and they can grab it. And in most institutions, most of those assisted living facilities, require it because, yeah, it's the right thing to do.
What are some of the options when you get close to the end of life? What are you dealing with?
Wow, I'm seeing that every day, because I go to the hospital every day and are working with families getting elderly people, usually elderly parents. How much life support do you want to continue? When do we start letting go of all this life support? When do we let nature take its course?
Right.
So I see it a lot in the chronic illnesses, Alzheimer's, Parkinson's, dementia, even some of the renal failure patients. So when things start kind of tipping, what are we going to do? And really the crux of it is, do we need to keep coming into the hospital when there's nothing more we can do? Patient's been in every 3 weeks for a pneumonia. We know it's going to keep happening.
Right.
Do you actually have to come back to the hospital to get IV antibiotics? Can we handle it at home? Can we keep you comfortable? And so the answer is, yeah, we can. And that's at some point in that trigger, in that disease trajectory, a person's has hospice available to them. So they have good care.
It's so interesting, because so often when an elderly parent or something has their first experience with something, maybe they've been diagnosed, they got the beginning stages of Parkinson's or Alzheimer's, and there's nothing in place, you would think that would be the moment the family would engage at that moment. You
would think. But then in these days, Marcus Welby retired, remember?
Oh, yeah.
He's gone.
Yeah.
And our family doctor doesn't come to see me at the hospital. So really the reality today is you have a hospitalist that really doesn't know you. And every 3 days, those hospitalists, because they work long hours, they shift and they go into a new team. So you get different healthcare individuals addressing the today's moment. Okay, this is what the sodium is. This is what your potassium is. How are we going to treat this? It's a day-by-day treating and having eyes on you that day in the hospital. So what's your long-term goal is really what this is about.
So where do they go to start? Do they go to a doctor first? Or they go to you?
First of all, they can get these anywhere. You can get these in any hospital. Doctors' offices have them. Our home care hospice office, people come in and pick these up every day. Look at it, read it. Give your ideas as to what you want. Be sure to talk to your family and your healthcare representative and say, you know, Perry, I'm thinking about having you as my healthcare representative. Are you comfortable with that? Ooh, that has a button on it.
That's right.
So sorry, an iPad.
It's the hospital calling.
And so you talk to your family, you talk to your healthcare representative. Are you comfortable with that? And some people may not. And that's part of this. The last session on the COHO, the Advanced Care Planning, we have facilitators helping an individual to fill this out and answering those questions. But really having your healthcare representative be aware of your decisions.
All right, we're going to take a quick break. We'll come back. Diane Kosmatka is with us. And again, don't forget, it's conversations about dying and then living well until it happens. And there are, looks like 1, 2, 3 more sessions for you to be involved in. We'll give you more details on that. And if you don't have one of these, let me encourage you to pick one up and read it and make some decisions. I have personally been involved with families that had them and those who didn't. And I'm telling you, when all this is done in advance, everybody's happy. We'll be right back. We're back with Diane Kosmatka. She is heads up COHO, which is choosing options and honoring options. And they're in a several-week series called Conversations About Dying and Living Well Until It Happens. It's held at the Smullen Center on Thursdays. You have an afternoon session and an evening session. 2 o'clock on Thursday afternoons, and then again 7 o'clock in the evening. And the next one coming up will be next Thursday, or this coming Thursday. Scenes from the End of Life. This is kind of a, it's kind of played out for those who prepared and those who didn't.
Yes.
So you got two groups of actors doing this. You know, you think, well, do I want to go to a play? No, wait a minute, this is a play with an impacting message. I can honestly tell you, I've done, when in pastoring and other things in my life, when you go to a family in the hospital that has not even done step one, it's very, very difficult to work with, very emotional. And I think this is a case of stewardship, don't you?
Yes.
For us to do this. I mean, I think it's just good godly stewardship.
It's taking care of our business. And what is our business? And it's financial, it's spiritual, it's emotional, and these can hit all of those, don't you think?
Absolutely. So check that one out. That's coming up this Thursday. And the week from Thursday, Families Telling Their Stories, which I think is in itself so compelling, because then you're going to hear from real life. And then the last one is very, very important. It's Advanced Care Planning. It's kind of a mini workshop where you'll go through these documents. And I would encourage you, if you haven't done anything in this realm for your life, especially if you're an adult and you have children, or maybe you got grandchildren, you have done nothing in this way of planning, let me encourage you to take advantage of this. Do they need to register?
They do for the last one on the 4th, because we need to have enough facilitators. We try to get people in groups of 4, so you're not overwhelmed with a whole room of answering people's questions. So a group of 4 of us will sit down and address those questions. So we try to group them with those that are kind of in between, like, I've had the first conversation but not the second, I'm kind of ready to finalize this and get it on paper. We put these groups together so it's not chaotic.
And they should call?
They should call the Coho office, and there's a phone number.
292-6466. Is that right?
That's it.
Okay.
And that particular one is going to be held at the Manor, the Rogue Valley Manor.
Okay.
The one on the facilitation, but all the others have been at the Smullen Center. Okay.
And if you need more information, you can get a hold of us here at the Dove.
Yeah.
All right, I want to come back to the process itself. Yes. And but before I do, you had a special guest, Michael Ravo, Dr. Michael Ravo. Tell us about his lecture.
He was amazing, and I've heard him before. He was in Seattle when John Forsyth received an excellent award, Sojourn's Award, and was the keynote speaker. All of us were like, oh my gosh, I wish more people could hear this. So I was so excited when he was here to speak for Coho. And that particular day, you have the numbers of who attended, but we had between both sessions, how many were there? 425 people.
425.
Which, you know, when you think about it, these type of conversations, that's a lot of people to stop what they're doing and come and listen to an unknown speaker on an unknown topic. His was so warm and nurturing about how do we care for ourselves, how do we care for others. He spoke a lot to clinicians, physicians, nurses, ancillary healthcare professionals. And one of the quotes that I really loved was from Robert Frost, and it says, hope doesn't lie in a way out, but a way through.
Wow.
And it's so hard when we know people are dying. We sit with people who are dying, encourage, coach through hospice. We know that life is coming to an end, but hope is giving them that process through. So they're not feeling abandoned, they're feeling cared for. We don't want to dispel hope when we know death is certain, no one gets out of it.
Right.
That was helpful. And the other thing he spoke a lot about was how we bear witness to another person if we just sit with another person and listen. Perry, you do it every day, going to the hospital. And when we as friends, as clinicians, partners, sit with another person and just listen, we're bearing witness to their soul. And we're walking through that journey with them, which can be very deep. We don't have to have answers. I think that's what I hear mostly people say. I don't know what I would say to them after someone's died. They just stay away if it's been a young death or a traumatic death. What would I say? And they're just uncomfortable, so they don't say anything. It's better if you just say, I am so sorry. I just wish there was something I could say to help. How you doing? Yeah. Just being with that person.
You know, I have to say also, you work with hospice, obviously, and the services that you folks provide is over the top. I don't know what we would do without hospice.
Boy, I'm fearful because of all the healthcare reform. Yeah. At every juncture, I'm looking to see, are they going to pull that? Because hospice is under Medicare. And Medicare funds us to provide that hospice service. We get a few dollars a day to balance and budget the services we provide. We provide all the equipment, all the medicines, the nurse, social worker, home health aide for bathing, chaplain, volunteers. I mean, computers, gas, getting people out to people's homes, all for that little small amount of dollars. So if we have people on for, a month or so, we can break even as a business. We're getting people in the last few days and hours. It's nothing to go out and admit a patient from the hospital and they're dead before you come back to the office. That is happening every day. It's wrong. Because what have we really served them with? Not a lot. We've gotten some paperwork done, but no one's helped them.
Well, I tell you, the other thing is people who have no spiritual hope.
Yes.
They have no spiritual connection, faith connection whatsoever, and they're facing this time in their life. The fear that's in their eyes and in their heart, going to the unknown, so to speak.
Yeah.
Now, I have seen hospice come in like that and calm the waters.
Yes.
And I, as a chaplain or a minister coming in behind that, the door is wide open, obviously, and many times to minister. But more importantly, the peace that you folks bring to a person that has no connection. I mean, it's just an amazing thing how God uses you guys.
Yeah, it's amazing. We feel blessed. We feel honored to be with that family. And we know there's things, not necessarily things we do, but again, that bearing witness and asking those important questions that elicit the responses that get people to go a little deeper than the treatments. Can you turn that oxygen up? How much is in the IV? We try to get away from the technical and get down to the soulful. And that's the big difference of modern medicine to this old-time medicine that we do.
You know, I heard a comment once, several times, and I'll have you comment. When people read this, and by the way, if you don't have this, you need to pick one up. You can get it at the hospital. It's called the Advanced Directive, Your Life, Your Decisions. This is a great resource, and it walks you through all of the things and the questions. And then if you don't have a medical directive, let me encourage you to get one. Usually an attorney will fill that out for you, but I think you can get your own, can't you?
The healthcare advanced.
Yes.
You don't need an attorney for this. You don't need an attorney's appointment at all.
Okay, and then these here. But some people say, well, I really don't want all of these tubes and all that stuff at the end of my life. I just want to go. But on the other things, but I don't want them shutting the door and letting me die on my own.
Right. That's what people fear.
That's what they fear.
Well, and the other thing that I think is a huge misconception is someone's going to take over for me. And I might not be ready for that. Well, the whole thing is, if you can talk for yourself, you're still talking.
You're still talking.
But it's when you can't talk. So when couldn't you talk? A severe stroke, motor vehicle accident, an aneurysm, some huge event that would put you totally incapacitated. And if you're young, that's one thing. If there's still hope, look at Andy, what he went through in his accident years ago. Man, you just don't know. You're at life and death. But for his age, you're going to do everything possible, and you did. But if mom's 93 and she's been in the hospital every month, it's like, gee, can we talk about this?
Yeah, and I think that's the obvious.
Yeah.
And how much it does help the family if you take care of this in advance. I think that's the main thing. You're being a good steward of your decisions, your thing, and you're really helping your family. Yeah. Right.
I'm seeing a lot of people entering in the hospital with fractured hips and their advanced age, their advanced Alzheimer's, and more decisions I think are being made. Do we really need to do that surgery? We can keep you comfortable. We can keep mom comfortable without going through that surgery, because going through it or not, it's a huge insult to the body. Likelihood they're not going to make it. So we approach people in these communities, living communities, and start to work with them and keep them in their community versus coming back to the hospital.
The other two things I know that people have struggled with, loneliness, fear, and pain, or the fear of pain.
Yes.
How do you address those?
I think the fear of pain is easily addressed if hospice is involved. If hospice isn't involved, I can't assure you that you'll be pain-free because of what it takes to get drugs to a home, to a living facility.
Right.
We need the right equipment, which is the medicines, and someone to direct the care and the delivery of that medicine. So every day I'm talking to facilities. They can't do anything without a doctor's order. Hospice is the intermediary between the doctor and that facility. So I'm faxing orders to them. Yes, you can increase. Oh, she's not comfortable. Let's go ahead and increase that dose. So I can write an order for the doctor, get that to the facility, they can start right now. But they can't do it without the order.
Right.
So we're the I don't want to say the police, but we're the intermediary to enable that person to get comfort.
Wow.
Because again, if you can't talk, can I tell that you're in pain if you're not speaking?
Yeah.
Well, I look at your face, and are you winced up every time I turn you?
Or blood pressure or something like that.
Yeah, blood pressure is high. It's like they're not comfortable.
Yeah.
Because when you can't talk, I'm going to be talking for you. I'm going to be assessing and making those changes.
All right, let me encourage you, again, check this out. You can call 292-6466, 292-6466. The next workshop coming up will be at the Smullen Center. It's this coming Thursday at 2 in the afternoon and repeat it at 7 at night.
Yes.
And that's going to be scenes from the end of life. This is going to be those who planned and those who didn't plan. The following Thursday will be Family Tells Their Stories, powerful testimonies. And then the last one on the 4th of April is going to be advanced care planning, and that's going to be up at the Manor.
Yes.
And you need to register for that.
Right.
And they should call the number to do that?
Yes, and I was going to say the families tell their stories. There's not like a ton of families. We have like 4 specific families that have really interesting stories that they went through, and they're healing through that journey. And they're very poignant, so people really usually love that one.
Check it out. Coho, that's choosing options, honoring options, 292-6466. Thanks, Diane.
Thanks, Perry.
Okay, we'll see you next time.
Okay.